For many years, WYLN TV 35 has hosted the Greater Hazleton American Cancer Society Telethon Live, and we're doing so again in 2020. This year, I want to also take a moment to tell you about the legislative arm of the American Cancer Society, called the American Cancer Society Cancer Action Network, or ACS CAN. They do incredible work on both a federal and state level, working with lawmakers along with their massive volunteer network to urge them to make fighting cancer a priority. Today, I'll speak with Pennsylvania Government Affairs Director for ACS CAN, as well as a cancer survivor and a volunteer. It's coming up on The Storm right after the break.
Your exciting new TV experience is here. Smarter, faster, easier to use. With live TV, recordings, video on demand, and streaming apps, all in a single place. When you're looking for something new, recommendations are tailored to you. Voice-powered, personalized results to find what you want faster. And the unlimited potential of smart home. The new experience from TiVo is here.
How you doing, everybody? This is Ricardo Santos from Yay Zapata. That's right, Yay Zapata in the house. That's what's up, that's what's up.
Meet Ricardo Santos. This is one of his Mexican food trucks. He is not a chef.
I'm not the chef.
But he makes amazing Mexican food. And he has joined the WYLN family with his own cooking show, Cooking with Jay Zapata.
CARES is a local and family-owned agency dedicated to providing exceptional services for individuals with intellectual and developmental disabilities throughout Pennsylvania. CARES specializes in day and residential services, respite, home and community, behavior supports, and chaperone vacations. At CARES, the participants are the VIPs. CARES, empowering individuals to maximize their opportunities and potential in their community.
Do you like craft beer? Do you want to learn the right way to sample wine? How about visiting a restaurant that has a unique flavor or a crazy food challenge? These are just some of the things we'll be featuring on our show, Wine, Hops, and Road Stops. Jeff Bonomo and his co-host, Alan Giannetti, welcome you into the world of craft beer, great wine, and good food. Wine, Hops, and Road Stops.
Welcome back to The Storm. I'm really excited about today's program. For over 40 years, WYLN TV 35 has hosted the American Cancer Society Telethon here live. But we've really not talked about the legislative arm of the American Cancer Society, called the American Cancer Society Cancer Action Network, or ACS CAN. And they're doing such great work to make cancer and fighting cancer a priority for legislators, both at the federal and at the state level. Today, I have two incredible guests with me. I have Emma Watson, who is the Government Affairs Director of ACS CAN here in Pennsylvania. Thank you for coming on the show.
Thanks for having me.
Happy to have you. And I also have Carla Rake, who is an ACS CAN volunteer. You also volunteer for the American Cancer Society, and you are a survivor of cancer. Yes. Thank you so much for coming on.
Thank you.
And I appreciate your bravery that you're going to be sharing your story a bit with us today, so thank you for that.
You're welcome.
I think you're going to inspire a lot of people to get involved with this organization, so I look forward to that. Before, Carla, we talk about your story, I want to go to Emma to kind of explain the difference between the American Cancer Society and the American Cancer Society Cancer Action Network, because they have the same mission, but they just go about it in different ways. So tell us about ACS CAN.
Sure. So the American Cancer Society and ACS CAN have the same goal, and that's to reduce the burden of cancer. But we go about fulfilling that mission in different ways. So ACS CAN is the legislative arm of the American Cancer Society, and our role is to work with elected officials on all levels of government to ensure that cancer issues are a priority.
Okay. Well, I want to do is, in this show, really focus on the legislative priorities here in the Commonwealth of Pennsylvania, because we have a lot of exciting ones. Tell us about some of the most interesting legislative accomplishments that have occurred recently in the Commonwealth of Pennsylvania due to the advocacy work of ACS CAN and your volunteers.
Sure. So in 2019, we saw a lot of great progress. We saw funding for breast and cervical cancer screening programs. We saw funding secured for vital tobacco prevention cessation programs, which are really aimed at keeping kids from using these products. Pennsylvania lawmakers made the decision to raise the purchase age of tobacco products to 21, which will have a big impact here in the state. And we also saw some gains on access issues, things like medication synchronization, things that will improve patient quality of life across the finish line.
Okay, help just for the audience, what does medication synchronization mean?
So it would allow a patient to pick up all of their prescriptions at one time, which really helps with treatment adherence, things like that, if you're not constantly having to make multiple trips to the pharmacy. So it's an easy fix that really improves patient quality of life.
Okay. You have some exciting new legislative priorities for 2020. And I'd like you to tell the audience a bit about those.
Sure. So in 2020, we're going to continue to focus on access issues through legislation that will streamline prior authorization and step therapy. So similar to medication synchronization, the goal is to improve patient access, make the process more transparent and easier for people who are going through cancer treatment or really any treatment for disease. We're also going to be focusing on prevention issues, things like teen tanning, and continuing to focus on tobacco control issues, wanting to secure that funding for prevention cessation programs for the PA Quit line, and also working to strengthen Pennsylvania's Clean Indoor Air Act.
Okay. I know a couple of these legislative priorities, you're going to be taking a lot of volunteers from all over the Commonwealth of Pennsylvania, well over 100 people. On April 7th, we'll be going to the state capitol in Harrisburg, and we're going to later in the show tell the people in the audience how you can actually be a part of this. But you'll be descending upon the Capitol, and you're going to be advocating and urging lawmakers to pay attention to a couple of those issues specifically. If you could share what's going to be happening there.
Sure. So Day at the Capitol brings together caregivers, survivors, advocates from across the state to meet with their lawmakers on these priority issues. And this year we're going to be really focused on that prior authorization and step therapy bill because it will have such a big impact on access to care and timely access to care, which is a priority.
Because right now, just to interrupt you, so right now, if I am a cancer patient, it could take weeks, days, weeks, or even months for an insurer to approve the treatments or tests that I would potentially need to treat my cancer. And cancer patients don't always have days or weeks or months to wait. I mean, they want to have timely access to care. So that's what you're talking about.
Absolutely. So this issue, this legislation would not eliminate prior authorization. What it would do is simply put on a time frame for emergency issues as well as non-emergent care so that patients and providers can know when to expect an approval from an insurer. So as you said, we don't have patients waiting around for approvals of whether it's drugs or tests or whatever their doctor has decided is their best course of treatment. That's really the key, that we want these important decisions to be made between patients and their providers. We don't want to see too much red tape coming in from insurers. So it's really not to eliminate these insurance practices, but just to streamline the process so that it's better for patients.
Okay. And then you have another issue that volunteers will be urging lawmakers to make a priority in Harrisburg. And what is that?
Yeah, so we'll also be talking about teen tanning. Really important issue. What most people don't know is that if you use a tanning bed before the age of 35, your risk for melanoma goes up 60%. So we have a real opportunity to reduce morbidity and mortality around cancer by preventing young people from using these devices.
Yeah, and it's scary because right now in Pennsylvania, if you're 17, you can use one of these indoor tanning devices as long as you have parental permission. And those are the kids who are going off to spring break, they're going off to prom, they're unfortunately sometimes tanning beforehand, maybe even unknowingly thinking they're doing themselves good by getting a pre-tan before they go into the sun, not understanding the kind of harm that they're doing to themselves or potentially doing to themselves.
Absolutely. The World Health Organization categorizes indoor tanning in the same cancer risk category as tobacco. We're not letting our young people smoke. We should not be letting them use these tanning devices.
Okay. With that, I am going to be going to commercial, but when we come back, we're going to be hearing a very compelling story from Carla, who is going to really personalize some of this and hopefully help us all understand why making this kind of legislation a priority is so important and why it's great for you to get involved with the American Cancer Society Cancer Action Network. We will be right back on The Storm.
SJ Kowalski is your Mitsubishi Diamond Contractor. They can install a Mitsubishi electric Mr. Slim ductless heating and cooling system. Mr. Slim systems are designed to make any living space in your home inviting. You can have a different temperature control for every room in your home. The money-saving technology can save you 25 to 50% on your heating bill. For Mitsubishi, Rinnai, and trained comfort specialists, call SJ Kowalski at 570-455-2600.
Join us this week on Let's Talk Chiropractic. You'll meet Hannah, a seamstress, who's going to tell you how chiropractic care helped her to get back to sewing after a car accident. Her story this week. Join us.
Are you getting the most out of your Medicare coverage? Did you know there are extra benefits available? Dental, vision, hearing, and prescription drug coverage? Don't worry, if you had no idea, you're not alone. Medicare can be confusing. Call Go Medicare today to ask about your dental, vision, hearing, and prescription drug coverage that could be included with your Medicare Advantage plan. That's in addition to hospital and medical coverage, often at no extra cost. Make sure you're on the plan that's right for you. Many areas have plans available with $0 copays for many services and $0 deductibles. Plus, premiums may be as low as $0 a month. We can help you discover all the benefits you deserve, maximize your health, and minimize out-of-pocket expenses. Call now for your free Medicare coverage review.
Please call 800-647-0289. That is 800-647-0289.
Have your event with Whitetail, graduation, birthday, bachelor, reunion parties? They have the most tranquil backyard experience with beautiful mountains in the background. If your company or business wants a different alternative to a golf outing, they have outings that can accommodate you. You can have the entire facility to yourself. They will work with you to set up your day of events. Sporting clay competitions, trap and wobble trap games, skeet. After a day of shooting, you'll return to a meal designed for you. Call Mike at 570-535-6123 for available group options. Want to watch WYLN over-the-air with an antenna? These maps make it easy for you to check out our over-the-air UHF coverage area using the Longley-Rice propagation mode. All of our broadcast and cable maps can be found on our Facebook page and on WYLNTV.com.
Welcome back to The Storm. Today we're talking about the American Cancer Society Cancer Action Network, which is the legislative arm of the American Cancer Society. They are doing incredible work urging lawmakers both federally and at a state level to make fighting cancer a priority. We learned a bit in the first segment about ACS CAN and what they do. What I want to do now is turn to Carla Rake, who is a cancer survivor who has been willing to come on the show, and share your story, which I just think is so brave and admirable. And I thank you for doing so because I think it's important for the viewing audience out there to put a face on this and importantly understand why advocacy work and volunteering for this organization is so important. So if you would be willing to share your story with us, we'd appreciate that.
Sure. Around 2013 in August, I kept hearing a commercial on the TV whenever I would pass by about any moles that were changing on your skin or growing or looked a little bit different. And that's when I noticed a mole on my abdomen that did look a little bit different. It seemed to be raised and growing. So I was able to make an appointment at the dermatologist and had a biopsy done, sent out for testing. The dermatologist office called back. It was about 14 days and said, I need to come into the office right away, immediately.
That's always a scary
Yes.
call. Yes.
I had just started a new job, so I couldn't go in that day. I went in the next day, and they told me I was diagnosed with melanoma. Wasn't really sure what melanoma was at that point, so they had set me up with appointments with surgical oncologist. They made all the appointments while I was there, so I didn't have to worry about doing any of that. When I got into the car, the first thing I did was Google melanoma.
And that's scary.
Yes.
Google is scary.
Very scary.
Yes.
Very scary. And that's when I learned that, probably because of my UV exposure from tanning beds and sun exposure from when I was younger, that this is probably what caused my melanoma. So I sat in the car for a few hours researching what I could on Google before I went back to work. I went back to work, calmed down, finished the day, and then moved on to a series of appointments with oncologist, surgical oncologist, medical oncologist, PET scans, CAT scans, had several surgeries. The melanoma had spread to my lymph nodes, so I had my lymph nodes removed from my left groin, very painful surgery. And I also had a treatment. We didn't have chemotherapy for melanoma, it's an immunotherapy that I had, so I did that for a few weeks. Actually couldn't tolerate the whole treatment, so I only did the first 3 weeks before I ended up quitting that treatment. So I think it's very important that everybody knows about the UV exposure, the tanning beds, what we can do to reduce everybody's risk. And
when you were using tanning beds, were you not realizing the risks? Did you think there were risks? I mean, I know certainly in my generation, we actually thought of it as safer than going outside into the sun.
Right. We always did it as a precursor to, oh, we'll go to the tanning bed, and that way when we go to the beach, we won't be so burnt. But with my fair skin, I shouldn't have been in a tanning bed to begin with. So,
how did you learn about the work of ACS Can?
I saw it on a social media site, the tanning bed legislation, and that's what prompted me to get involved. I also have another friend that is involved with the Tanning Bed Legislation Act.
Because it is so important. These kids, they're going in. I mean, Emma brought up a startling statistic that just one exposure can increase one's risk for melanoma, which is the deadliest form of skin cancer, by 60% if you're under the age of 35. And that statistic, I know, is even higher if you're under the age of 25.
That's correct.
Yeah.
That's correct. Most people don't think about the serious adverse health effects of utilizing these devices. You're looking at premature skin aging, you're looking at permanent eye damage, as well as skin and ocular cancers.
And I did some homework before this show, and 1 in 8 high school teenage girls has used an indoor tanning device in the last year. 1 in 8. So there are a lot of lives that are being put at risk by doing this activity, and we just need to protect our minors in Pennsylvania. What has volunteering done for you in terms of education and through your process of, I suppose, healing?
Well, it's given me a bit of an outlet where I can try to educate other people. I volunteer with a couple different organizations. As long as we're spreading the word and educating and trying to do the legislative part and get rid of the tanning beds, hopefully we can save some lives.
And I'm thrilled you're going to be going today at the Capitol in Harrisburg this year on April 7th.
Yes. Can't wait.
You're going, and by the way, I'm going for the first time ever, because I do want to use now to say that I was so moved learning about the work of the American Cancer Society Cancer Action Network, as well as my own father's unexpected advanced cancer diagnosis in 2019. From the time of diagnosis to the time of his passing, it was 4 months, and it was a horrific experience. And as he was in bed next to me, I was his caregiver, and I curled up next to him, and a position came up with the American Cancer Society Cancer Action Network, and after some interviews, I got the job. And so actually, Emma's one of my colleagues. I'm excited to be at the Capitol this year for Day at the Capitol on April 7th. Emma, tell us a bit about what happens during that day, how that day sort of evolves and what the process is, and then we'll get into how people out there, you can all come.
Sure. So it brings together advocates from across the state to the Capitol in Harrisburg. We provide all of the necessary training, so no experience required. We set up meetings with your lawmaker, so you'll have the opportunity to meet face-to-face with your lawmaker, with their staff, and talk about these important cancer issues. It's also a great opportunity for networking with fellow advocates, as well as just learning more about the legislative process.
Okay. I have to go to commercial. When we come back, we're going to talk a little more about it and how you can get involved. We'll be right back on The Storm.
The Falvello Law Firm, located at 641 Route 93 in Sugarloaf, offers help with car and truck accidents, wills, powers of attorney, and estates. With a small team of attorneys, they work directly with each and every client, serving all of northeastern Pennsylvania. They are proud to offer legal services that make a real difference to you. Call them at 570-788-4191. When you see news happening in your neighborhood, call WYLN News at 570-459-1869 or email us at news@WYLNTV.com or send us a message on social media through Facebook. WYLN, we're your local network.
Tune in every Sunday night on WYLN from 8 p.m. to 9 p.m. for hard-hitting, high-flying, non-stop action as only Pennsylvania Premier Wrestling High Voltage can bring you. That's Pennsylvania Premier Wrestling every Sunday night on WYLN. I'll see you in the ring.
Whitetail Preserve has an immediate opening for a chef. Please call 570-455-4251, extension 1378 for details.
Did you know that WYLN News provides news updates every weekday afternoon at 1, 3, and 5 here on TV and on social media? Did you also know you can watch WYLN News on the go by visiting our website or YouTube page? Now more than ever, WYLN is your local news leader.
What's on TV? Plenty. WYLN TV 35, the best in local programming.
Welcome back to The Storm. So before I get back into how people can get involved with Day at the Capitol and sign up, you said something at break that intrigued me in terms of the impact that people can make when they do volunteer work for ACS Can. I'd like you to share that with the audience.
Sure. Something that people don't often think about is that when they're engaged in something like cancer advocacy, we have the opportunity to make broad level change when it comes to improving public health in our communities. So you're taking an opportunity that will not only impact you, but it will impact, everyone in the Commonwealth. If you're working on federal issues, everyone in the nation. So by coming and sharing your story and being engaged and being an advocate, you have a real opportunity to elicit positive change in your community.
And that's so true. And that's why, Carla, you coming on the show is so important, because there may be someone out there who has their story that they haven't shared, and they now may be inspired to share it. And it may be an important story to share, whether it's for these legislative priorities or other legislative priorities. So really, thank you for doing this. Emma, how do people sign up to go today at the Capitol?
Sure. So you can visit us online, fightcancer.org, search for Day at the Capitol, and there'll be an Act Now button. If you click that button, you'll be provided a little bit more information, as well as a survey to sign up and RSVP.
Okay, and then they'll arrive in Harrisburg on April 7th. They'll be greeted, they'll get their t-shirt, they'll get their legislative packet, they'll be educated, as you said, prior to this, so over the phone via a webinar.
Yep.
They'll get there, and then they'll go off to meetings with their respective legislator on these particular issues.
Yes, so we go ahead and make this as easy as possible for you, provide you with all of the training and information that you need, as well as schedule those visits with your lawmaker. So when you arrive, you'll be provided that schedule, you'll know where to go, what time to go, who else is in that group if there's other constituents from your legislative district in attendance, and we'll send you on your way to conduct those meetings. We're having a press conference that day that we would love to have advocates participate in, and then we hope that you come back to our table, learn more about how you can be involved, and report back on how your meeting went.
Okay, and what's exciting too, this year, the National American Miss Pennsylvania teen, the current reigning one, is Julia Snyder from the greater Hazleton area. The issue of no teen tanning has been one of her pageant platforms for years, and she's going to be coming today at the Capitol this year, which is terrific. We also are anticipating having a number of high school students from a lot of schools. There is still an opportunity for high schoolers out there who are watching to come, for adults out there who are watching to come. We definitely encourage high schoolers to get involved. Number one, you're doing a great thing for the day. And also, what a wonderful thing to put on your college transcript that you advocated, you went to your state capitol, you met with lawmakers, and what you were doing is something that's an actual bipartisan thing. You're fighting cancer. Who doesn't want to fight cancer?
Absolutely. It's a great educational opportunity, networking opportunity, and not to mention, one of our priority issues this year, teen tanning, relates directly to that population. So you have the opportunity to speak on something that affects you, affects your classmates, affects your peers.
I just think it's so exciting. I can't wait. It's going to be my first day at the Capitol in April, so I can't wait. Carla, is there anything, just in closing, I'd really, as a survivor, first of all, I just want to say, how are you doing? How are you feeling?
I'm fine. I had all my scans and testings done recently, and everything's clear. Everything's fine.
Wonderful. That's the best news of this entire show, actually. So really, I'm glad to hear that, and I'm so glad you're going to be a day at the Capitol. I'm glad that you're sharing your story. I think there are, unfortunately, plenty of people out there who have had your exact experience, who were using indoor tanning devices, thinking maybe that they were not doing something harmful, or even thinking that they were doing something that was helping them from a safety standpoint before they went into the sun outside, and now they're faced with a potential skin cancer diagnosis. So thank you for coming on the show. Emma, thank you for your great work. I love working with you.
Sure.
I love working with the American Cancer Society Cancer Action Network. And remember, folks, when you look around and you don't like what you see, don't complain about it. You can do something about it. You can fight cancer. Sign up and join us this year, April 7th, for Day at the Capitol in Harrisburg. Thank you for watching.